Welcome back. It's 2023 and we'll kick the year off with today's video discussing osteoporosis as an immune imbalance rather than a calcium deficiency. And for reference, if you're interested in this topic, about 4 months ago, I made a video called Osteoporosis and the Bone Gut Axis, where we talked about this topic as well. So please reference that, and I will link to that in the video here. But today we want to look at research talking about osteoimmunology. So specifically how the immune system is functioning in the bone and how that relates to bone loss. And as a spoiler, we'll find out that bone loss is more about an inflammatory issue than it is a calcium deficiency. And if you're someone with osteopenia or osteoporosis and you've been taking your CalMag supplements and not seeing a prevention of further bone loss or a gain in bone, then your issue may not be calcium, it may be inflammation. And if you're a postmenopausal female, it's highly probable that your issue is inflammation and not calcium. And we can discuss or describe more of that with today's research. So let's dive into the paper. And here we are in this paper published in Nature entitled Updating Osteoimmunology, Regulation of Bone Cells by Innate and Adaptive Immunity. And so this paper is a great paper with many good graphics. So if you're really interested, I suggest you pick it up and read it. But we'll focus on a couple of the images in this paper today. And we'll head right down to the first one here, which this image is showing us the immune system specific to and bone physiology in rheumatoid arthritis. So what you'll see here is that we have innate immune cells, which are the first line of defense in the immune system. They're the first responders, think local police or fire department. And what they do is they're the first responders, so they're going to see things first. They will be the first to see the infection or to pick up the chemicals or substances that let the body know, hey, there's an intruder or a foreigner here. And once the local police pick it up, they then send messages to the SWAT team, and the SWAT team shows up and performs their job. So in the case of rheumatoid arthritis, this is showing it going awry and promoting the autoimmune bone loss seen in rheumatoid arthritis. So it starts with inflammation. Inflammation drives an immune environment that leads to, in an autoimmune context, leads to expansion of Th17 cells. And Th17 cells are the immune cells that drive the tissue damage and autoimmunity. So this Th17 cell will spit out interleukin 17, which causes osteoblasts to make this pro-inflammatory message. And it also tells fibroblasts that are in joints to make this pro-inflammatory message. And that message comes down here and drives osteoclast function. And osteoclasts are the immune cells that break down bone. Okay, so osteoclasts are macrophages by nature. Macrophage is Latin for big eaters. So macrophages are immune cells that eat things. Osteoclasts are specifically eaters of bone. Okay, so this pro-inflammatory process drives autoimmunity. In this case specifically, it's rheumatoid arthritis, and the increased inflammation drives increased osteoclast function, which leads to increased bone eating or bone breakdown in rheumatoid arthritis, specifically at the joints. So you can see here how inflammation is driving an autoimmune disease of bone, namely rheumatoid arthritis. Now, if we step back a minute, we want to say, well, what's driving this inflammation? right? And that's a great question. The answer to that is unique to each individual in front of us. So the inflammation in one person, may be coming from the gut. The inflammation in another person might be coming from the mouth. And in either of these places, if either of those are involved, it might be due to dysbiosis or imbalance in good bugs and bad bugs. So microbial overgrowth or microbes entering where they shouldn't. Maybe the chronic inflammations due to chronic stress, maybe food stuff, maybe toxins. There's lots of things that can drive inflammation. So that is specific to each individual and needs to be determined by the clinician that they're working with. But if we take a microbial stance, I want to head down to this image here and show you how microbes could drive bone loss. Okay, and so what we see is in this image, you can see here, we're looking at the mouth, and we all have teeth, or hopefully you still have teeth, right? And we can see the tooth above the gum line, but then there's a root to the tooth that goes below the gum line. And many people are familiar with leaky gut. So let's start there and we can come back to the mouth. So here we're talking about the gut, okay? And gut lumen is the space inside the gut. So if you picture your gut as a tube, when you swallow food, that food is not inside you yet. It's inside the tube that is your GI tract. Okay, it's in this gut lumen, or in the inside of the tube. It has to pass through the wall of the tube to enter the body. Okay, but that tube wall is made up of gut epithelial cells. That's a 1 cell thick layer of cells separating your inside from your outside. And so if something occurs to cause damage to these cells and make them leaky so that more things get through, then that can drive inflammation. So in this image, we're seeing bacteria enter through the gut lining and drive systemic inflammation. When microbes enter an area where they shouldn't be, that's pro-inflammatory. Now, we get that when we're talking about a pathogen like Helicobacter pylori or Staphylococcus aureus or something like that, C. diff, E. coli, salmonella. But what if these are probiotics? What if probiotics enter your body? Would that be pro-inflammatory? It can be. And you might say, why? Well, the metaphor I thought of is this. Say these are probiotics and they're right here in the gut lumen where they should be. That's cool. They're welcome there. And say these probiotics, say we pick out this one and say this one is a friend of yours, not your best friend in the world, but more than an associate, right? You might hang out with them. You might have them over to your house. So this friend is welcome here. If you're out on say the gut lumen is your porch. If you're out on your porch and that friend walks up, you welcome them up to the porch, no problem, they're welcome here. But say you go out and, you left your door unlocked and this friend comes up and you're not on the porch. And they're like, well, I want to hang out with you. You're not here, but we're friends, so I'm going to let myself in. And that person enters your house. And then you come home and you see that person sitting there on your recliner. Remember, you're friends, you're more than associates, but you're less than best friends. That might make you mad, right? You might say, what the heck are you doing letting yourself into my house, hanging out on my recliner when I'm not here? So in the same way, probiotics that our immune system tolerates and has a synergistic relationship with when they're where they should be, might trigger the immune system and make it mad and set off inflammation if they enter where they shouldn't be. Okay. So if we have a good bug or a bad bug enter the body where it shouldn't be, that can drive systemic inflammation. And when those bugs enter, they have parts of them that our immune system recognizes. And they're called pathogen-associated molecular patterns, or PAMPs. So it's kind of like if your friend comes and they have a certain cologne or perfume they always wear. You kind of recognize that person by their smell. So say they're in on your recliner, and before you see them in your home, you smell them, right? Well, that smell is the PAMP, or the pathogen associated molecular pattern. Each one has its own smell. Or microbial associated molecular pattern, where, you know, pathogen would be always bad guy, but the microbial one might be from a probiotic, which is considered a good guy out here, but a bad guy in your recliner. Okay. So when your immune system picks up on their smell or on their perfume, that leads to an immune response and pro-inflammatory release, and again, drives osteoclast production and bone loss. So that can happen whether the microbes are entering through the barrier at the gut or at the teeth. All right, most people are aware that we have a gut microbiome. We also have an orodental microbiome, it's called, which is a mouth microbiome. We also have a sinurespiratory microbiome, or bugs that are normal and probiotic in our sinuses and in our lungs. We have a skin microbiome. We have bugs everywhere. There's normal ones that should be there, and there's potential pathogenic ones that shouldn't be. So if they enter through the gut or through the gums, we can drive systemic inflammation either way. Really? Mouth bugs can drive inflammation? Sure, you've probably heard of the periodontitis, so mouth inflammation, periodontitis, heart disease connection, right? So I've done a video on this in the past, and I can link to it here, but periodontitis is breakdown of basically the gum barrier. So you have leaky gums, and there's certain microbes like Porphyromonas gingivalis that can enter the bloodstream and travel to the heart and attach to the valves of the heart and drive heart disease and drive autoimmunity such as rheumatic fever. And so parts of that bug are similar to the valves of your heart. So the immune system, a non-discerning immune system, may shoot at your heart valves thinking it's the bug. And we know how that will end. That's not good. So this is really interesting because these bugs can enter, drive inflammation that leads to bone loss. So the bug doesn't necessarily have to eat the bone away, like you see here, like a cavity being caused by these bugs in this tooth example. Gut bugs could drive bone loss at sites far away from the gut. And that's what's really interesting about the text here under this picture. So it says, under normal or inflammatory conditions, microbes can affect bone resorption at sites proximal, which is close to, and distal or far from the site of colonization. Okay, so bugs can impact bone, it doesn't have to be local to where the bug is. A bug in your gut could affect bone loss in the big toe, say. All right, how does it do that? Molecular triggers like the PAMPs and MAMPs, the cologne and the perfumes, right? Molecular triggers from gut bugs cross the epithelial boundary, like we talked about up here, more readily under dysbiotic and or inflammatory conditions than normal conditions. Okay, so dysbiosis is imbalance in good bugs and bad bugs. So say you took some antibiotics, or you eat a bunch of food sprayed with glyphosate, and that stuff destroys your good probiotics. Well, then maybe you have yeast overgrowth or C. diff or salmonella or something. Bad bugs colonize. That's called dysbiosis. Okay, so molecular triggers from the gut bugs cross that gut barrier more readily under dysbiosis or inflammatory conditions than normal conditions, but it can still happen in normal conditions as well, and might eventually influence bone at faraway sites, either by entering systemic circulation or by activating the local adaptive immune elements within the mucosal tissue that can transit to the faraway sites and exert their function, right? So they can drive bone loss through systemic inflammatory processes or by activating the immune system against it, which would lead to issues similar to what we saw up here with the rheumatoid arthritis example. Lastly here, the oral microbiota can also contribute to inflammatory bone loss at faraway sites, such as the joints of patients with rheumatoid arthritis. So again, the gut is not everything. We're as a society, we've become more alert to the importance of the gut, and the gut is super important because up to 80% of the immune system is in the gut, as I've discussed in my book. But any place where we're exposed to the outside world can contribute to the bone loss. And they use the mouth as an example here. So the joint pain, you know, if a rheumatoid arthritis patient says, well, what was my initial cause? That's really hard to answer for anybody. But, you know, if that person has a history of oral issues, maybe gum disease, maybe root canals, things like that, well, perhaps that's tied into their later development of rheumatoid arthritis through these microbial mechanisms and these inflammatory mechanisms. So I thought this was really cool and a really good job by the paper to create images to help us see visually how microbes at faraway places like the gut, lung, sinus, or bladder could drive bone loss and contribute to rheumatoid arthritis via an autoimmune mechanism, or contribute to osteopenia or osteoporosis via a systemic inflammatory mechanism. So very, very important, and helps you understand if you're taking calcium and you're not stopping your bone loss or reversing your bone loss, that might explain that calcium is not your issue, and you should investigate with a clinician whether, you know, a microbial dysbiosis at one or more locations is your issue. We talked earlier about postmenopausally. It's likely an inflammatory driver behind your bone loss more than it is a calcium loss. And one way that, you know, why postmenopause, right? Well, postmenopausal, in menopause, you're going through the process of your ovaries coming offline or shutting down, and your hormone production is shifting to just adrenals and your fat cells or your fat tissue, leading to your estrogen, progesterone production, hormone production. So as you lower estrogen, if you don't have optimal estrogen levels, losing estrogen promotes osteoclast production and growth. And if you have more osteoclasts, which are bone eaters, than osteoblasts, which are bone builders, blast B builder, then that leads to a net loss of bone. So the sex hormone deficiency, you know, the estrogen loss contributes to bone loss by driving osteoclast production, by impacting the immune system, because remember, osteoclasts are immune cells, they are macrophages. So again, that's a contribution by the hormonal change to inflammation and immune imbalance. So I hope this wasn't too sciencey for you guys out there. I hope that these pictures help you see what I'm showing you from the text, and helps you understand if you're not getting the results that you were hoping for from your calcium magnesium supplement, or even your weight-bearing exercise, that investigating your systemic inflammatory status and your microbial status would be a next logical step to go to. So if you need to know how to do that, I would suggest reaching out, locating and partnering with a functional medicine practitioner who can understand these things, knows how to test these things, and then most importantly, when you find these things, knows how to implement clinical strategies to help you achieve your goal of halting and or reversing bone loss.